Hi, I'm Marty Salt, and you're watching WFTV.com's Care Connect. Kidney stones affect millions of people every year. Fortunately, there are advanced, effective treatments available right here in Central Florida. Joining us today to share what we need to know is board-certified urologist Dr. Prakash Maniam from Oviedo Medical Center, part of HCA Florida Healthcare. Welcome, doctor. Thanks so much for being with us.
Thank you for having me.
First of all, what is a kidney stone, and what are the symptoms? I hear they're painful.
Yes, a kidney stone is a group or aggregate of crystals which are normally dissolved in the urine, and so they pass through the body normally on a routine basis. However, when those crystals are high enough in number in the system, they can get so large that they obstruct the flow of urine, and that's when the symptoms come about. And the symptoms are primarily pain, and they can be very severe pain. And this pain can be either side. It usually radiates towards the front, associated with nausea, and there's usually some urinary symptoms as well, which are urgency of urination and blood in the urine.
So how common are kidney stones? How are they diagnosed? And I actually understand that we live in a stone zone of the country, right?
That's right. Stones affect about 1 in 10 people in this country, and they are diagnosed primarily by your symptoms. There's a classic presentation with your symptoms and the nature of the pain and the way it radiates. Also, some lab tests, namely urine tests, which can show blood in the urine, some blood tests, and also imaging tests like X-ray, CT scan, and ultrasound will help diagnose it. And yes, there is a region of the Southeast United States that has a higher incidence of kidney stones compared to the rest of the United States. And that's presumably due to higher temperature and maybe some changes in the diet.
Anything related to obesity, diabetes?
Yes, people with diabetes and obesity seem to have a higher risk of kidney stones as well.
And do they show up in men more often than women?
Yes, men have a higher risk of kidney stones than women do. But we're seeing more women with stones in the recent years as well.
And why do you think that is?
Well, I think that men primarily work outdoors and get dehydrated more easily. But now that's becoming common to both genders.
And how are you treating kidney stones now?
Well, there's a variety of ways to treat the kidney stones. We usually try to allow the stones to pass themselves, and they can pass spontaneously given some supportive care like fluids, either oral fluids or IV fluids. Some medications help stones to pass, and mostly just time. There are some interventions that we can do and that we offer at HCA Florida Healthcare that are called lithotripsy, and that can be done with ultrasonic energy, laser energy, or shockwave therapy.
Sounds like something I'd like to prevent in the first place. So can you prevent them?
Absolutely. Primarily the prevention is first and foremost hydration. So we really need to keep our water intake up, and that comes out to about 80 ounces per day. Now, included in that water, you can add some form of citrate, because citrate's been shown to inhibit kidney stone formation. So that would be lemons or limes or oranges, or lemonade itself has also been shown to be helpful.
80 ounces, so almost a gallon.
That's correct.
Almost a gallon. I have a long way to go. All right, thanks so much, doctor. And if you would like to learn more about comprehensive health care available in our area, please visit HCAFloridaHealthcare.com. I'm Marty Salt, and thanks for watching.